Welcome to Resolve IBS and IBD Naturally. I'm Courtney Cowie, a nutrition therapy and functional diagnostic nutrition practitioner. If you are struggling with the symptoms of IBS or IBD and want to get to the root cause of your symptoms so you can take back your health through a whole person approach, this podcast is for you. Just a disclaimer that the information I'm presenting in this podcast is for educational purposes only and should not be taken as medical advice. You should always consult a qualified practitioner before making any changes to your health or medical regimen. That being said, let's get on with the show. Welcome to episode 2. So today I want to distinguish the conditions IBS and IBD a little bit and also talk about a concept that I know other practitioners, especially conventionally trained ones, will likely disagree with. And the concept is this, that IBS and IBD are really on the same spectrum of disease. And I'll explain that as I go along and talk about this from more of a functional perspective when we look at just chronic inflammation and chronic disease states like that. Let me just start by saying, when I had my first colonoscopy many years ago, I was initially given a diagnosis of IBS-D, sent home and told to try a probiotic, which is not surprising or uncommon in the conventional space. But I know that years after that, when I started to actually slide back downhill again and struggle, when I started to go back in and seek the help of GI docs, a lot of them told me like, oh, it's probably just IBS. We don't really need to do a second colonoscopy. Try this, try that. They kind of ran through their gamut of tools. Of course, nothing was working. Not surprising, right? This is partly why I got into the path and became a practitioner as I did. But I will say that several years later, I did finally elect to have a second colonoscopy done. And the practitioner I was working with at the time thought that enough time had passed, it made sense. And interestingly, after that second colonoscopy, found out I did have an IBD diagnosis of microscopic colitis. So I can at least say in my experience N of 1 that it is absolutely possible for IBS to eventually turn into IBD. I don't know statistically what percentage of people out there that captures, but I think having come full circle with my training as a functional practitioner, understanding the body from more of a holistic lens, I think that that possibility is always there, especially if the genetics lay the groundwork for that potential gene expression. And that's always kind of the wild card that we never know when we're on this path of life. And, we're considering what may or may not happen with our health. And I think that, all chronic health disease could manifest in any hundred of different ways for a given individual. And it just depends on the triggering events and exposures and factors that set off particular disease states or help those things to kind of express. And so I may dive into that in another episode down the road, but I just want to speak to that piece of, possibility. And, you know, in the conventional medicine world, I feel like it's very easy and clean to deal with one label at a time and consider things through just the lens of IBS or just the lens of IBD. But one big difference that, we try to do, at least in the functional space, is to look at things more holistically. And yes, we want to know the label if there is one, but we also want to take a step back from that and understand, okay, what are things going on outside of just this system? And what are some clues we might be able to look for that could explain why the system is expressing a disease state or why this person has, 3 different systems that are expressing symptoms, for example. We don't just limit it to one clean lens through which we're viewing the body. And that's with the understanding that when health breaks down, it's doing so because of a multitude of different factors impacting it. And we want to try to unravel that tangle, if you will, and help clients figure out what are the different areas of their life and health and nutrition and potential other imbalances that are driving this entire mess so that we can get their health, help them get their health back on track. And the more factors we identify, the better chances of that there is. So let's talk a bit about just IBS and IBD as different conditions. So IBS is considered a diagnosis of exclusion because typically these are people who go in to see a GI doc. They're given a full workup, which often will include an endoscopy, a colonoscopy, sometimes a bunch of other tests as well. And basically, at the end of all that, nothing abnormal is found. And then normally the doctor will say, look, like we did all this testing. We can't find anything that actually shows on the scale of diagnosable here. So you have IBS or irritable bowel syndrome, and there are some things we can try to help you with your symptoms. And that's basically as far as it goes. And that, again, just to kind of reinforce the point, this is the way that the conventional medical system is set up to work. It's set up to diagnose and prescribe and treat a disease, not necessarily help troubleshoot the symptoms on the path to having a diagnosable disease. That's a very different thing, in my opinion. Now, IBD, or inflammatory bowel disease, is usually characterized by some degree of tissue damage. It often comes after an endoscopy or colonoscopy, or both have been performed, and visual damage is observed by the performing doctor, or it's seen under the microscope, or after a biopsy was taken of the tissue, and then they see the damage. And that would be, like, especially in the case of microscopic colitis, something they would see after they take a biopsy and put the tissue under a microscope. And so, there is that differential there. But what I do want to say is that both conditions, as well as most chronic health conditions, share a common characteristic of ongoing inflammation. And that's just a principle that we work from in the functional medicine space, that we're always kind of concerned about this idea of inflammation and minimizing inflammation. In fact, I would say it's actually a buzzword. Now, what exactly is inflammation? Most of us have a general idea of what inflammation is, but to get a little bit more specific, I did pull the definition from the American Heritage Dictionary, and there were 3 definitions given. One of which is, I think, helpful in our case here. But the first one is the act of inflaming, or the state of being inflamed, which kind of points us right back to inflammation. What is it, right? The second definition, a localized protective reaction of tissue to irritation, injury, or infection characterized by pain, redness, swelling, and sometimes loss of function. So I think this kind of gets at the idea that there's some degree of activation of the immune system, irritation, injury happening, and also visible, observable changes to the tissue happening. And then along with that, this disruption in function, or sometimes even the loss of function, which I think is a good way of kind of looking at any number of chronic health conditions, definitely anything on the autoimmune spectrum, but even things like chronic joint pain could also be characterized that way. The third definition is the act of inflaming, kindling, or setting on fire, also the state of being inflamed. So again, we're kind of pointing right back to inflammation. But this third definition kind of provokes this image of a fire, which also can be quite helpful because one of the things I think that can be especially challenging when it comes to inflammatory states is getting those things to kind of calm down and balance out. And, with a really big fire, you're not going to put that out with a couple drops of water. It's going to take a lot of, counter force of the right properties. So a big bucket of water, right, to put that fire out. And there's kind of this balance when we look at just the overall I guess you could say, state of the body, where we absolutely need to have the ability to inflame under the right conditions. So, one easy example of that would be if you do any type of strength training or muscle conditioning, you are literally causing a breakdown of muscle tissue, which is going to cause some degree of inflammation, which, when that resolves, will hopefully lead to a stronger, bigger muscle, right? But in the case of chronic health issues, the issue becomes that inflammation switch gets turned on, and it becomes especially difficult to get it to turn back off, or to kind of find that balance between being in an inflamed state and then bringing the inflammation down appropriately. And it's like anything, we want to be able to have an action take place when it's appropriate, but we also want the body to be able to kind of manage that and turn that off so it doesn't become, in this case, damaging or counterproductive. So if we look at just this definition of inflammation, we're really sort of seeing this central theme of the immune system basically mounting a response to some sort of provoking agent, which could be a lot of different things, especially from a functional perspective. But when the immune system is in a chronic state of creating inflammation, the majority of the time there's going to be some degree of immune dysregulation at play. And this is because of, whatever that provoking agent is causing the immune system to kind of basically act up. And sooner or later, if that switch doesn't get turned off, it will start to lead to tissue damage and destruction. Now, this is really important to just think about because a lot of people don't realize this, but most autoimmune conditions, especially, can take decades to fully reach a diagnosable level. So, in other words, the actions that are leading to the tissue destruction could already be in place at a very small level, and over time, slowly building and slowly kind of going in a more severe direction. Um, and then years, after maybe the beginning of the symptoms happen, a person might finally go into their doctor, or maybe it's the 10th time they go into their doctor. And now finally there's enough of a damage there or an immune reaction response there that they have this diagnosis that's achieved, right? And there is a time and a place for that. And I think, if you've been struggling with your health for a long time, it can be validating to actually go in, have the test done, and feel like this isn't all in your head. Now, in the case of IBS, that often doesn't happen. A lot of times, at least the clients I've worked with IBS, and I know in my own case before I had a formal IBD diagnosis, I was made to feel like I was crazy sometimes and like I wasn't doing enough with, the things the doctor was trying to tell me to do to keep the IBS under control. And all the while thinking like, no, like this is more serious and I am doing everything I can and this is still happening. So IBS can be very frustrating in that sense because if it doesn't rise to the level of a visual actual problem, it can very much feel sometimes like you're just beating your head on against a wall and being told that this is because of stress or this is because of depression or this is because of any number of things, nerves even, right? Genetics, who knows what, causing these issues. And what's really often happening is there is the same mechanism at play, just at a much minor level that really can't rise to the level of detectable, at least as far as that diagnostic criteria goes. But with IBD, yes, it can be very affirming to, finally know, hey, like there is literally something going on here. This isn't just like my body going crazy for no good reason. So there is a time and a place to have that evaluation, that diagnosis, and that's all fine and good. But at the end of the day, the process is not really set up to help patients get clear on what are the factors driving what's going on. And even if you have the label, you have the diagnosis, you're still often left with the prospect of taking a med, or trying maybe some lesser invasive things or lesser disruptive things to the body that often are not going to be enough alone to help make this symptom picture go away, right? So it kind of points back to this problem of, all right, what do we do to try to troubleshoot these symptoms and understand what's driving these up until the point we get a diagnosis? And that's not really a process that conventional medicine is set up to address. And so that's why I think a lot of people get very frustrated when they're struggling with symptoms for a long time and going in to see different practitioners and being told that, nothing's wrong or finally something is wrong, but then the solution I'm offering is just a drug. So I just want to make that point because I think it's valid, and I know that I personally experienced it when I was a patient in the system. So we can think about conditions like IBS and even other conditions that are, beyond the gut, things like fibromyalgia and chronic fatigue as being kind of these idiopathic conditions that, are recognized in conventional medicine, but not well understood and often become these diagnoses of exclusion because there isn't this one thing or like specific diagnostic criteria that can often say like, yes, without a doubt, you've got this. It's sort of given based on this collection of symptoms and ruling out more serious things. So, often you're going to see some crossover, especially with these three conditions. There's always an element of fatigue, I feel like, but especially with chronic fatigue, there can sometimes and often be body pain or stomach pain or, different types of pain going on as well with all of these different conditions. And so, there are those similarities, but I would still say if we're looking at all chronic disease as being on this spectrum of chronic inflammation, we could put these kind of on that milder end of the spectrum compared to more serious things like IBD or other autoimmune conditions like MS or rheumatoid arthritis or what have you. It's just how definitive is that damage, how serious, how expressed are, the things showing up in the body. I've actually heard other functional practitioners even talk about disorders like type 2 diabetes and even cancer, in the sense of looking at these things through immune dysfunction, almost like having autoimmune characteristics, because often with all of these immunoregulatory disorders, you're seeing some aspect of underactivation of the immune system, while also there's an overactivation of the immune system all at the same time. And so it's just really interesting to kind of think about that spectrum, and just giving that context, I think, is helpful because it helps us understand that the body often will break down as a whole, not just as a part. And again, to try to troubleshoot this backwards, we really want to take stock of where are we along the spectrum? How bad is it? And how many different factors feeding into this disease state can we potentially identify and work on to start to walk this backwards and help the body regain health on its own? So I think that kind of covers it for the second episode. I just wanted to lay that context of, chronic inflammation being the root of all chronic disease, especially from a functional lens. I wanted to talk about the possibility that, something like IBS could absolutely become a form of IBD down the road if there's that genetic potential. And the other thing I just want to mention along those same lines too is that it's also well known that in the autoimmune camp, once a person is given one autoimmune diagnosis, it's much more likely that they will have a second or a third diagnosis in their lifetime if that disease state continues, without interruption. It's very common to see other systems and tissues start to get impacted as well. So I think that just kind of reaffirms that there's this kind of collective process happening in the body. And it's really just a question of, how expressed is it or how severe, and what can we do to try to figure out what the driving factors are. Did you find this episode informative and helpful? I'd love to have you leave me a 5-star rating. Do you have questions about holistic approaches to optimizing gut health that you'd like to ask? Please leave your question or comment below, and I will be sure to address it personally or cover it in a future episode. Be sure to check the show notes for any resources mentioned in today's episode. See you next time.